Hi everybody, my name is Sarah and I get a lot of requests for updates with my spinal cord stimulator video. I made a few of them and it's been a couple years and I've had people send me messages, hey, will you please do an update? So I'm really sorry that it's taken me this long to do an update, but I'm doing one now. So anyways, to just kind of back up a little bit, because some people that are watching this might not have watched my original videos, but back I've had chronic pain in my left hip for about 7 years now, and tried everything, injections, medication, acupuncture, I mean really anything that they recommended I did. Nothing ever helped the pain, so what was option for me was to get a spinal cord stimulator. Now, my pain has always been in my hip. I didn't have back pain, but now, you know, this is 2.5 years after spinal cord stimulator, I am having a lot of issues where they put in the spinal cord stimulator, and I'll kind of let you know about that as I go through the video. But when I had the spinal cord stimulator implant, I had the trial in October, and then I had the leads implanted in December. That never worked from the get-go. I never felt stimulation in the correct area. It was like in the knees down, and like I said, my pain has always been in my hip. So they decided right away that they were going to have to do a revision to paddles. So I had that done in March, so it was like 3 months later after my first surgery, and I never felt right, like in my back. I always kept thinking, man, I just am not healing right. I always felt like I had very stiff muscles in my back. It just never felt good afterwards. However, I did get pain relief in my hip, not 100%, but I did get pretty good, you know, maybe 40% relief from the type of pain that I had in my hip. But fast forward to about 2 years later, I went back up to where I got the implants done, which is Stanford Medical Center in California, which they're great. I have literally, this is not like to complain about them at all. I had excellent care. My surgeon was wonderful. I know that things happen in surgeries. Like this is just the way it is. But I went back to them, and this last December, right now you're watching this in August, so December of 2017, I went back, kind of follow up. Why am I not getting better? I have such stiffness in my back. I can barely walk. I can't stand very well. And long story short, they had told me that I have compression fractures in my thoracic part of my back, and that my spine looks very old, like maybe somebody like in their 80s would have. And I'm 40. Well, at the time I was 42, and I do have some scoliosis and kyphosis and degenerative disc issues, but none of those things should be why my bones are fracturing in my back. Nothing like that should be why I have broken bones in my back, but I do. Anyways, I ended up, they changed some medication, they did some physical therapy, and I did some other stuff, and I ended up losing weight. I've lost 50 pounds, and because I thought, you know, if my spine is that old, you know, carrying that extra weight can't be good. So where am I at? Oh, so that was like in December, and then around March I started feeling much better. I was, you know, between those months I was walking 3 miles a day. I felt good at work. It was like literally the best I had felt since I had all these pain issues. What is going on? Oh, my dog and our donkeys back there. I was like, what is making all that? See, they're sassy. Anyways, so I felt great. Well, then I felt so good that in March I tried Zumba, and I refractured my T9 vertebrae. That was one that had already showed that there was a fracture, and then I had another x-ray after I knew I messed it up, and they said that I had caused more damage to it, basically refractured it. So that was middle of March, and then probably June I started to feel better, and like from March to June it's awful. Like the only position that is comfortable with a compression fracture for me anyways was laying down. Standing, walking, and especially sitting. Anytime sitting in a chair it was excruciating, but it's different than the type of pain I have in my hip. My hip pain is like nerve pain, and it is horrible. Like, I can't even describe how bad that pain is. This is like a different type of pain. This one gets better when I would lay down. With my hip pain, no matter how I would it would hurt no matter what. It never felt better. So I would lay down when I would get home from work and, go back to work the next day. Eventually I started feeling better. So fast forward to, so I work for the schools, and I'm usually off June, July, and I go back August. When about a week before I went back this August, I sneezed and I refractured the same T9 vertebrae. And, I was really, I am really bummed out because, I've been really trying to take it easy on my body since I know that I have these bone issues. And, when I went to the hospital this last time, they had also said, your spine looks really old. The doctors, he's like, yeah, I showed my colleague, you just look like you have old bones. My primary here doesn't know why I keep fracturing. This should not be happening to somebody my age, to keep refracturing. The only thing that I can think of, and this is just my personal theory, I don't know if this is the reason why, but my paddle that rests, the paddle for my spinal cord stimulator rests on my T9. They shave part of the bone off during the paddle surgery. So the only thing I could think of is that my bones were compromised after they implanted that, and that they just can't get better. And especially since, March I've fractured it twice, and it's only August. What's really difficult is I do work full time. My kids are active with sports, school stuff, church. It's not like it's not easy for me to just come home and do nothing, but I do have to come home and pretty much am bedridden until the next day, because in the beginning of the school year I just can't be off work. I work in family services, and I work with high-risk families, and I just don't want to be off the first part of my school year. It's just it would be really difficult on myself, difficult on the families. Thankfully, I have a lot of family support with my mom and dad, my husband, my kids, my in-laws, like friends. Everybody has, offered to give my kids rides or, whatever I need, so I can rest when I'm at home, and I'm really thankful for that. So what's next on my journey is, in a few weeks, I'm going to go back up to Stanford, and I'm going to see an endocrinologist that specializes in rare bone diseases in women. She actually taught at Johns Hopkins University. She's new to Stanford, so I'm really anxious to figure out why these things, my vertebrae keep fracturing. I have two that I know of. T9, and then I believe it's T8. The T8 one's been stable. That one has not refractured. It's the T9 that's been giving me problems, and again, that's the same vertebrae that they shaved to where my spinal cord stimulator paddle is. So it's been a really crappy journey. I have to say that, some people will say, well, do you regret doing the spinal cord stimulator? That's like, I don't even know how to answer that right now, because I do get, like, I know 40% isn't that much pain relief, but for that type of pain in my hip, it's horrible. Like, so I guess I should say yes, it was worth it, but I sure wish that you know, and maybe it's not even related to the spinal cord stimulator. I really don't know. I hope to get some more information. I feel really lucky that I do have really good insurance. I have access to tools to help me have good family support. Like, I cannot imagine going through any of this, having to, you know, worry about how I was going to pay for any of this, because it's been really expensive. I shouldn't say like really expensive for me, but if I didn't have insurance and you know, access to physical therapy and medication and other tools, I don't know how people would do it. It'd be very depressing. I mean, and I just want to like kind of touch on that when I say very depressing, because anybody that goes through chronic pain for, you know, as long as I have, it sucks and it's sad. I don't want to say that I've ever been like clinically depressed, because I don't think I've ever been clinical, you know, like the clinical depression symptoms or whatever. But I mean, there's been lots of times that I have locked myself in my room and cried all night just because I couldn't imagine dealing with this pain one more hour. Obviously it's not like that every day, but sometimes it is. And especially, you know, in my journey, and I call it a journey, as far as my years of suffering with chronic pain, it's, you know, you'll feel good for a while, or not good, but tolerable, like where you feel like you can be a mom, you could be a good employee, and then something happens and then you're back down in the dumps again, dealing with, you know, back to where you were at square one. So it sucks. I feel very blessed. I do have a lot of faith that I will get better. As a Christian, I know that the Lord doesn't put us through things that without reason. So, you know, at least I know that whatever, there's some sort of reason that I'm going through all this suffering. And I, you know, honestly, I am okay with that. I have to be. What am I gonna? You know, some people will tell me, oh, I can't believe you're doing so great, you're an inspiration and blah blah blah. I actually do not feel like that at all. Like, anybody that goes through this, you would do the exact same thing I'm doing. I'm not any better than anyone else, because you cannot give up. Like, I cannot just lay in my bed and think, okay, I'm never gonna get better, I'm not gonna fight for treatment. I'm just not gonna do that. I have 2 kids, a husband, my parents, my in-laws, my friends, my extended family. There's just so many people that rely on me, and I rely on them. I'm not just gonna give up. So I am always gonna fight to get better. I will always fight for treatment. I just have way too much to do to fight. One of the things that scares me, though, and you know, realistically, I always think, you know, it is scary to think I do not want to go on disability. I do not want to be stay at home and not work. And I absolutely love my job. I work with families, like I said, high-risk families, and it is my passion. I absolutely love what I do. And so that is kind of scary to think that I will not be able to do it because of my physical limitations. That does scare me. But like I said, I'm gonna keep fighting. I'm gonna keep trying to get treatment however I can do it. So I know that's like a really long video, kind of like we're all over the place, but a lot of people, I mean, I probably get an email once a week asking for, hey, will you do an update on your spinal cord stimulator video? So here is my update, and I will try to make more videos. It's kind of awkward sitting here talking to myself. I'm doing it when nobody's home, so people will be like, what's mom doing out there talking to her camera? So anyways, feel free to ask me questions. I'll try to get back to you. and hope everybody has a great day. Thanks.